So you think that wearing a posture corrector or doing some fancy yoga stretches is going to magically cure your back pain? Let's just pause for a moment to appreciate this sweet yet misguided belief. As much as we'd love to live in a world where a simple gadget could fix everything, reality is a bit more complex. Back pain is a tricky beast. It's not just about bad posture or lack of exercise. It's a result of factors which are beyond our control. So, while you're busy adjusting your posture corrector for the 100th time today, your back pain is having a good laugh. And don't even get us started on those miracle back pain exercises. Sure, they might provide temporary relief, but they're not a cure. They're merely a band-aid for a much deeper issue. Now that we've cleared the air, let's dive into the real deal, shall we? Let's kick off our list with something that sounds like it's straight out of a sci-fi movie. Nerve stimulation. Imagine a tiny device sending electrical pulses to your nerves, like a microscopic DJ remixing your pain signals. Sounds cool, right? But don't get too excited. It's not like you'll suddenly develop superpowers or anything. Next, we have orthopedic supports and cushions. Not the most glamorous solution, but believe me, your back will thank you. Imagine sitting on a cloud, your spine perfectly aligned and no more back pain. Sounds like a dream, doesn't it? Well, wake up, because this is reality, and these cushions are the real MVPs of back comfort. Moving on to spinal injections. Now, I know what you're thinking. Needles in my spine? No, thank you. But hold on, it's not as terrifying as it sounds. It's like having a tiny, very professional and highly skilled mosquito taking a sip from your spinal cord. And the best part, it can give you relief from back pain that's been hanging around like an uninvited house guest. Now, let's talk about the elephant in the room. Herniated disc scans. It's like ordering a full health report for your back. And if you find out you've got a herniated disc, well, at least you'll finally have a valid excuse to avoid lifting heavy stuff. Lastly, the final boss of all back pain solutions, back surgery. It's like a reset button for your back. And no, it doesn't involve a mad scientist with a chainsaw. It's a precise and delicate procedure done by highly trained professionals. So if your back pain is more stubborn than a mule in a mud pit, this might be the solution for you. So you've made it through the list and your back still hurts? Well, we have a bonus round for you. Ladies and gentlemen, welcome to the bonus round, where we reveal the mystery culprit that could be causing your back pain, sciatica. Now don't be fooled by the name. Sciatica isn't some exotic Italian dish, nor is it the latest dance craze. It's actually a pesky little nerve that runs from your lower back, through your hips and buttocks and down each leg. Talk about a road trip, right? When this nerve decides to throw a tantrum, it can cause pain, numbness, or even a tingling sensation that can radiate along its path. Yes, you heard it right. Your back pain might just be a sciatic nerve having a midlife crisis. So, how do we handle this unruly traveler? Well, physiotherapy, pain medications, and in some cases, surgery. Remember, it's always important to consult with a healthcare professional to get the right diagnosis and treatment. And there you have it, folks. 6 not-so-secret ways to destroy back pain like a pro. So, let's quickly jog our memory, shall we? Because clearly, in the last 4 minutes, we've all become certified back pain experts. First things first, we've debunked some classic back pain myths. Remember that? No, we're not talking about your grandmother's advice to stand up straight, or your gym buddy's assurance that deadlifts are the panacea for all back troubles. No sir, we're talking about real, scientifically proven, doctor-approved solutions here. So, sorry to burst your bubble, but those YouTube tutorials on posture correction and that fancy exercise ball you bought off Amazon aren't the magic cures you thought they were. Now, on to the good stuff. The real solutions. The ones that actually work. Number 1 on our list is nerve stimulation. Sounds like something out of a sci-fi movie, right? Well, it's not. Then we've got orthopedic supports and cushions. Yes, we've all seen those infomercials with the overly enthusiastic spokesperson proclaiming how this or that cushion will solve all your back problems. And while we might have been a bit skeptical, turns out there's some truth to it. Who would have thought those cushions, when used correctly, can really help alleviate some of that back pain? So go ahead, get that cushion. Up next, we've got spinal injections. Now, I know what you're thinking. Needles in my spine? No thank you. But hear me out, these injections can be a game changer. They can help reduce inflammation and provide relief from chronic back pain. Now, on to the more serious stuff. If you're experiencing severe back pain, it's crucial to immediately scan for a herniated disc. This isn't something to mess around with. And then, worst case scenario, back surgery. Now, I know that sounds scary, but sometimes it's necessary. Remember folks, we're not here to sugarcoat things. And finally, the bonus round, sciatica. Now, this isn't a rare, exotic disease from some remote part of the world. It's a very common cause of back pain, and it's something you should be aware of. Sciatica refers to pain that radiates along the path of the sciatic nerve, which branches from your lower back through your hips and buttocks and down each leg. So, if your back pain is accompanied by a shooting pain down your leg, it might be sciatica. And no, it's not something you can cure with a hot bath and a good night's sleep.